I've had a lifelong interest in photography. I love photography and I love medicine. And I've had a long interest in skin cancer. And the interesting thing about where skin cancer's gone in the last 15 years is the link between skin cancer medicine and digital photography. Digital photography has made a huge difference to our ability to diagnose early skin cancers, particularly early melanoma. And the important aspect of skin cancer medicine that has made photography important too is dermoscopy. And dermoscopy is when a lens is placed directly on the skin and preferably with a liquid medium between it, such as one of these, with a liquid medium right on the skin, and with this you can see about 1 millimetre under the skin. So you're not looking just at the external patterns of the skin, what you might see with a magnifying glass, but you can see deep inside. And when you see deep inside, you see an entirely different picture. And with that, you can see clues to the early development of, for example, a melanoma at a stage when, if it is removed, you can guarantee 100% cure. These are called level 1 melanomas. And dermoscopy, looking through this, and particularly when a camera is added, such as like this, then you can see not only inside, but you can actually photograph inside a mole and see it, the structure inside a mole, and gives us amazing clues of about the nature of a lesion. All this was not available when I started medicine 40 years ago. 40 years ago we were told that melanomas were black, 6 millimetres across, bad news, often associated with a very poor outcome. Now, with dermoscopy, we are finding lesions as small as just over 1 millimetre across, because we're able to look inside a highly magnified image and under the skin up to 1 millimetre down, and we're able to take very clear, high definition photos and study these. Sometimes we take photos serially, 3 to 6 months apart, when we're looking at borderline lesions. This is called sequential dermoscopic digital imaging. And with that, we can look at the changes over a few months. This is a very, very powerful way of finding early melanomas, again, at a stage where it's 100% curable. So melanomas is not all bad news. Early melanomas are discoverable using dermoscopy, and particularly dermoscopic photography. And with that, we can save lives.